want to share a little bit of patient-savvy lingo with you today. You know, in dentistry, we are notorious for saying something we've always said. And what happens is people change, times change, and we don't keep up with the times. So for years, we've seen a commercial with Listerine that says, you know, stops bone loss. And so we don't have the marketing budget that they do, so we use those same words, and they go right over their head. So hygienists and doctors listening, I want you to think about the next time that bone loss or bone resorption is about to part your lips, that you think about saying, you know, Miss Smith, I'm concerned about this lower left area because, in fact, the bone has continued to melt away. And just watch the patient's face. Melting away sends a whole different message than bone loss. After all, if we lose a little bone, maybe we'll lose a little weight. And how bad can that be? So think about the words you use and how that matters. Now I want to talk to you about dental work. One of the phrases I loathe more than almost anything in dentistry. I don't know where we came up with this, but I want you to think about when you get your car worked on. You take it down to the shop and they work on your car. Dental work just is, it's not at the level of what you do. So I want you to think about the next time you want to say, or say we're going to get you back for your dental work, or let's talk about the dental work that you need. I want you to really focus hard on saying dental treatment. You know, doctors prescribe some dental treatment. Let's see about getting you on the appointment book for this dental treatment, or better yet, dental therapy. How many diabetics do you know that are in insulin therapy and they don't miss those appointments and they check that blood sugar and they do what they're supposed to do? So think about the words you use because they do matter. Now, the age-old, you're here for the necessary x-rays, or it's just going to be a little x-ray. Little is a limiting term and makes everything you say after little or small or sort of, kind of, all those things are limiting terms and they almost disengage the patient from anything you're about to say. Instead, I want you to think about saying, I'd like to take the x-rays that the doctor ordered this morning in the morning meeting when he or she looked at your file. Taking the x-rays the doctor ordered is much like going to the actual physician and saying, the doctor's ordered a mammogram. I'd like you to schedule this mammogram. We're concerned. So think about the words that you use and the impact that they have. When it comes to dental insurance, I love this savvy lingo because what we know is it's really not like insurance in the way that a patient thinks of it, like in medicine. It's really more of a benefit or coupon. And we will regularly say, when we take the phone call and they want to know about insurance, we will regularly put that off to the side, create value for this, and then come back to the money. We pull it back into the conversation. When we do, we will say, we have someone on our team that can do a complimentary benefits analysis. Would you like us to do that for you? Sometimes people are actually a little taken back and they say, I don't understand what you mean, benefit analysis. Well, you had said that you had some benefits. Finally, you put the words together, or you may have called it actually insurance. They will say, yes, I do. And you'll say, well, technically it's a benefit, because what we know is about 65% of Americans have no benefit at all for dentistry. Because you have it, it is a benefit, but it functions more like a coupon. In other words, it's not set up like medicine, and it will only pay for a portion of what you need to have done. So just be sure you're using the words that make the impact where you need it and not where we've put it because of the ways that we've always said things. When we talk about dental implants, I want you to think about this is still an area where misunderstandings run rampant. And understanding and having everybody on your team on the same page with what we say when it comes to this kind of high-end treatment is really important. In our office, if anyone is asked, whether they're on the phone, whether it's an assistant, hygienist, or even the doctor initially, what exactly is an implant, we will say it's a man-made root, because in fact, it is a man-made root. Now what we know is, it's not a tooth, so man-made teeth go on top of it. It's similar to when we talk about dentures and someone will say, well, I'm just going to need to get dentures because of XYZ. What we know is, dentures are a replacement for no teeth. In other words, if you have no teeth, dentures are a great option. If you have teeth, dentures are not an option. Because your teeth have roots, dentures do not have roots. That's why we can go through the whole system and talk about a man-made root and a man-made tooth that goes on top of it. One of the other things I want you to think about is how people learn and how much they're visual. When you're talking about implants and talking about dentures, remember to say, and we do this, the only reason, Miss Patient, that your bone is in your face from here to here is because your teeth are there. The minute your teeth are gone, in this area to this area, that's when your bone begins to melt away. Turn your face to the side and say you've seen someone in church or at the grocery store and their nose is moving to meet their chin. That's someone who has no teeth and they have no roots. So be sure you're using words that put the impact on the treatment that you can deliver. When someone says, I understand that they screw an implant in your mouth, remember to say, technically, the implant is gently threaded into place. And that's how it bonds with the bone. So I want you to think about the words you use. Instead of saying less expensive, if someone said to me, I have a car and I bought a car because of a GPS. It's a true story. I bought the car because of the GPS. Because I'm geographically challenged, I wanted the GPS to be one that was very simple. He said to me, do you want this rim or that rim? And I said, well, I don't know, because the rims weren't important to me. And he said, well, this is a less expensive option. I wanted the nice GPS. I went with the less expensive option on the rims because it was not what I was interested in. Had he said, now I've got something cheaper here, I'm not interested in cheap. Please don't confuse me for someone who's looking for something cheap. But when you say less expensive, I feel like I'm a smart consumer and I may choose that option rather than understanding what it really is. It is cheaper to not have any implants and just get a denture. But at the end of the day, what do they really have? We will often tell them, my husband had a professor in dental school who said, charge twice as much for the upper denture and give them the lower one for free. Patients will look at me like I've lost my mind. And I say, no, really, he had a professor that said this. Because at the end of the day, what we know is when you come back and you tell me that that lower denture doesn't fit, I can say, well, what do you expect to get for nothing? So think about the words that you use and how you use them. And instead of saying someone's a candidate as if they have to try out or be on social media for implant or cosmetic dentistry, please think about saying that our doctor will give you every available treatment option that's designed to fit your needs and desires. I hope you enjoyed this savvy lingo.